Hi, everybody. I'm Karen Rigamonti, and I am here with Geoff Grant um, to have a conversation. So let me introduce myself, and then Geoff can introduce himself as well. I'm Dr. Karen Rigamonti. I am a physician by training who wears several hats, one as a participant in healthcare, one as the caregiver of various family members for healthcare provision, and one as a clinician. So what I do now is help build more resilient cultures through enhancing communication, compassion, and several other elements that I will discuss as we move along. Geoff, why don't you introduce yourself?
Hello, everyone. My name is Geoff Grant, and I'm the author of The Intentional Caregiver. And I'm also a caregiver to my wife, and I'm a coach, caregiver coach, and a speaker as well.
So today, Geoff, I think that one of the things you and I have been discussing several times now is the role of caregiving and care providing. And we both work on leadership and coaching, and yet we've noticed that healthcare organizations and individuals that work there are not always meeting the needs of the patient and families. I'm sure they think they are, but for some reason there's a disconnect. And what I'd like to do is kind of go back and look at this issue. And I know that you are newly involved in this once again, because your wife, Karen, is also going through a new medical issue. So why don't you bring up your situation, and then we can kind of banter from there.
Okay, thank you, Karen. My wife is a 16-year survivor of mesothelioma, which is a lung cancer, and she lives with chronic breathing issues. And she was recently diagnosed with breast cancer, and right off the bat, I feel that I, as a caregiver, am not receiving support from the healthcare institution. And they did ask her if she wanted any support. It was kind of a closed-end question. Do you want support? She answered no.
Yeah, so what we both, I'm sure, are aware of is it's not just did you ask the question, but how you asked the question. Because most of us would say, do you want support? And the answer would be automatic reflex, no. Just like when people ask you, how are you feeling today? And we automatically say, oh, great, or fine. And we don't really go into the truth because we know that people really, that's what they're looking to hear. And they're busy, and we accept that. But obviously, within that, if she answers no, she's not really getting the support she needs. And maybe she doesn't know that she needs it or even know what to ask for. So it's easier to just say no. And the fact that they're not asking you, you may be aware of things she may need, and you may have your own needs because you're the primary caregiver for her. So why don't you elaborate a little bit on what you think would have been a better question?
Well, I'm not sure of what questions to ask, but right off the bat, I wish there would have been a conversation. I wish it would have, I guess I could say, is there anything you need right now? Or how are you feeling right now?
Yeah.
Well,
I think, is there anything you need might give the same no answer. But I'm feeling like if someone were to ask you or her, what were the biggest challenges you had yesterday or this past week? That might bring up the conversation and actually help people, both yourselves and that person that's asking, understand better what you're going through, both from a physical and an emotional and a spiritual point of view, so that it could be addressed and that they could make the proper resources or references available to you.
I agree. At first, I was a little disappointed at the healthcare institution for not engaging us a little bit, both a little bit more. But I can see, but I know they have, significant resources, significant, a lot of programs in place to help patients and caregivers. I think that they just don't know how to ask.
Yeah, I think that you don't know how, as patients and family members, to ask for things that you don't necessarily even know exist. You don't have time to start combing through websites because you're already a little bit overwhelmed and stressed with just getting through the day-to-day. And I think they assume that it's all out there on the internet and you can find it or you'll ask for it. So I don't think there's any malintent on anyone's side, but it's a really challenging situation when we don't ask the right questions to help people move forward.
You're spot on. It's challenging, and it creates confusion and assumptions as well. And I just want to be engaged with the process. The whole reason why I wrote my book is because I had to learn on my own how to take care of myself, how to reach out for support, and so on. And I don't want to, how should I say it? I don't want to, learn how to do it all again. I just want them to engage me, or maybe I need to ask some pointed questions.
Right. So what I was going to say is, you don't have to do it all again because you already know the things from your first experience that work or don't work. So
That's right.
how would it be better for you? What could you do to bring out that conversation? Because you're right, they're falling short, even though they're giving great medical care and you're in a fabulous institution. No question about it, with lots of brilliant providers, very skilled. So what could you do as a family member to encourage that dialogue? Because just acknowledging that you're not getting it is the first step. But then we have to own our own accountability and responsibility to try and get what we need.
I think I could start by asking my wife if she needs anything. How is she feeling? And secondly, I think I can reach out to the institution and start asking them, what kind of programs do you have in place? This is what I need for support. Like virtual support groups, any resources they have online, because I know we're in a COVID crisis and I realize that in-person gatherings are difficult these days. But maybe I could ask them, what kind of in-person groups they have, or one-on-one support, possibly in person, because it's important. It's important during a medical crisis. It's important to know that you have support from different aspects, especially from the institution, because the institution has so much knowledge and so much invested and they know support is a huge part of the process. We all know that you can get the best medical care in the world, but if you don't have support, it doesn't make a difference how good the medical care is.
I love what you're saying, because it's so true. We're not just treating a disease, we're treating a whole person, and that whole person comes with their family and everything else. And when we go into that short circuit of assumptions, we change the expectations, and then people become disappointed. And when we're disappointed, we want to blame somebody else, and we start judging them. And that's not healthy for them or for us. And it doesn't build a solid, connecting, collaborative relationship. Yeah. So I agree with you that, you're going to have to reach out both to your wife and to them, as far as, since it doesn't seem to be happening from either source. And it's really hard to know what to ask or what to provide when you don't have that information behind you. So what I'm hearing is the first thing that needs to happen is that we catch ourselves when we go into that, is this okay? Do you need, or whatever, and start asking those open-ended questions like, what are your challenges? What are the things you're confronted with? What are the things that are most pressing to you? What are the feelings that are happiest for you at the moment, and the feelings that are most discouraging or frustrating for you at the moment? Because when you ask it that way, they start thinking about it. When you just say, do you have any? The answer is no, because it's hard and it's painful to look at those, and we don't want to blame anyone. And having a healthcare issue, no matter whether it's minor or major, is really isolating. You feel really alone. And as the care provider, you feel the same way, and almost even more helpless, because you want to help the person in all aspects, and it's very challenging to do. And you don't always see the right results or fast enough results. And sometimes you get a little rebellion in there too.
Yeah, I think my expectations have gotten in the way. Like, I had high expectations of support this time around, and those expectations weren't met. And I was in disappointment rather than be in curiosity. If I was in curiosity, I could say, I could maybe go to their website or call them sooner and invite a discussion, rather than kind of dwell in the fault into the expectations that weren't met.
Well, you make some great points. And of course, one of the goals would be that you don't end up blaming yourself for what the situation is, because clearly it's not any one side only. So what I notice when working with people is when we provide a gift, whether that is a physical gift, an acknowledgement and recognition gift, or the gift of providing knowledge for someone else, it not only feels good, it helps remedy the problem, and it also makes us feel good that we provided that information. So I'm also guessing that one other avenue to address might be that you considered what you could do to show them the right questions, because it's not that they're not asking, it's that they're not asking the right questions to get an accurate response. And then to remind them that when they are asking, it's equally important to ask the care provider or caregiver in the family, and not just the patient, because there's two sides to this and they're both equally important. Because you need to stay healthy in order to help your spouse as well.
That's true. That's true. It's so important to make sure as a caregiver, make sure your cup is filled, because you can't provide support when you're worn out, or you don't take care of yourself as a caregiver. And another thing is, what I know to be true is, when the caregiver gets the support they need, they're able to accurately ask the right, I'll say more questions, or more pointed questions towards the healthcare team, and they know what to look for in the patient, or the loved one, I should say. So often doctors miss things that the caregivers see in the patient. They don't live with the patient. They don't see things.
Absolutely. I mean, you're with the patient way more time than any physician or nurse or therapist at the hospital. No question about it. So you're going to see things, even if you don't know how to interpret them.
That's right.
That you can provide information with. So it's a win-win for everyone. And it's so important that you're included in this conversation, because for sure you don't want the caregiver to feel like it's their fault, or have self-blame, or even lose their ability to have self-worth and realize how valuable they are in this process if no one ever includes them in the process.
That's right. And that's what's happening now. That's what's happening now. I don't blame the institution. I tend to look for answers, or look for solutions. And if I did have a conversation with them, I think it would be a more improved and productive caregiving experience.
Yeah, and it would be better for you, for them, and for your wife. And so it's that ability to have meaningful conversations with effective listening and really compassion, and speaking from the heart, and feeling what the other person is feeling and addressing it. It's not okay to just feel it, it's acting on it as well. It's the full gamut, and when that happens, everyone feels better. Our ability to receive the kindness and feel the kindness and do it for each other is immensely supportive. And the healthcare provider is also feeling stressed and overwhelmed, because the system, especially now with COVID-19 around, is very stressful. So I, having worn all these hats, feel very sorry for them as well, and want to help them and see their perspective. But it's equally as important as the patient and the family assistant that you're included equally, so that everyone benefits.
I agree, and I think it's so vital to connect with people. So often in the caregiving experience, we tend to want to believe things like, I need to give my all to the patient, to the loved one, when clearly that's just not good for anybody, including the caregiver and the loved one. I've had, many years experience in caregiving, and this situation is different. And it's important to acknowledge that.
Yeah, you're so right on that. Every situation, even for the same person and the same caregiver, is different and comes through a different lens, because we go back to our past experiences and we build on those and we move forward. And so I think that the things that would help the best are encouraging conversation with patients, families, and the full medical team. It would be to increase the ability to actively listen by asking open-ended questions to get true responses rather than dead-end no's and end of conversation. And to keep the door open and continually ask again, and what are the challenges you faced yesterday? How are these different from last week? And keep reminding them of different resources that you perceive they might help with and what others are out there. Because we don't always know the right questions, both as the caregiver, the care provider, or the patient. And it's hard to know. And we need help on that.
It is hard to know. And it's, I just want to circle back a little bit. It's a new experience. It's a new disease. It's, there's going to be new questions, new feelings. And I don't want to, I'm not going to assume I have all the answers. I want to be curious. I want to be open-minded. I don't want my past experiences to cloud my thinking.
And that's so hard to do, because I know that very often we see the situation as a difficult patient, a difficult family member, or a difficult healthcare staff person. And we go in kind of with our defense system right up there, and kind of like, that doesn't serve anyone. And whether we're high on our emotional intelligence or low on it, we have to try to contain our emotions and speak from facts and speak from our heart how it's making us feel. And when we reveal that and we ask them, and how does this affect you? Then we get the real dialogue going. And that's so important, as you pointed out so beautifully.
Thank you. It's the dialogue is so important. And I think sometimes the healthcare team doesn't, looks upon the support staff differently. I don't think it's integrated as much as it should be. I don't know how you feel about that.
Well, let's first clarify for the people listening in, what do you mean by the support staff?
The support staff in terms of the social workers, the emotional support for the patient and the caregiver.
Right.
And
I think there's a lot of truth in that everyone isn't included in the dialogue. Sometimes it's just who you're speaking to when you're trying to make an appointment that could be very frustrating. Sometimes it's a social worker that's providing one set of pieces of information, but you want a different set, and they don't understand what you're looking for, and they think they're doing their job. Neither one is wrong, neither one is right. We all, I believe, are partially right in everything, which unfortunately means we're partially wrong in everything too. And that's human nature. We're not here to change that, but we are here to improve upon how we treat each other and respond to each other. And the most important thing is keeping a dialogue, a conversation that's meaningful, engaged, with open-ended questions, so that we can really find out what people need and try to address those things.
conversation for me is very near and dear to my heart. And I want to be seen and I want to be heard as a caregiver. so I can be the best caregiver and support for my wife as I possibly can.
Well, I know you've been heroically by her side for many years, and I'm sure she's very appreciative of it. And yet, like any other human being, we all annoy each other from time to time. And I'm sure she plans to tell you some of those times, sometimes saying them nicer than other times. And I'm sure you want to do that to her. And it's really hard when the patient's going through things that are really challenging for them to let them know, but they're not serving them or you when they don't respond well. And that's true whether it's you, the caregiver at home, or the care provider at the hospital. And so it's a triangle that's got to be balanced. And we all have needs and different lenses that we view the system through, and how to keep that conversation open, because you may meet the needs today, but there's new needs tomorrow, and they keep changing, and it's never the same, and it's never assumed that the same things are needed, even with the same, in your case, couple, because new situations arise, and each individual deals with them differently. And that's true whether it's the staff person or the person at home or the patient. And it's keeping that dialogue open and remembering that everyone needs to be involved, and having some, in this case right now, it has to probably be virtual, but team meetings, because it's really important that the social worker hears what the physician says, what the nurse is saying, what the patient is saying, and what the family care provider are saying. And everyone needs to be part of the dialogue, because we all come at it from different angles, and we don't know what the need is.
That's, I couldn't have said it better. We don't know what we don't know. And the conversation, it's in the conversation where the richness comes in, where the where the emotions come in, where the information comes from, rather than just saying, do you need any support?
Yeah, because we all know the answer is no. It's an automatic reflex. And
Yes.
it's very seldom that someone's going to go beyond that without those open door questions. I know in my own experience, I was talking to a head nurse, and she said whenever she asked her staff nurses if they need her help, and she was so caring and supportive, they would say no. And I said, well, what are you asking them? And she says, do you need my help? I said, well, of course, that's why you didn't get any information. They said no.
Yeah.
Otherwise, they're thinking you're going to judge them as not qualified and not good and not doing their job. But if you ask them what were their challenges, so we walked around together. I didn't say a word, and I just was there as that reminding force in her leadership training and coaching. And I stood there, and she started to say, do you? And she looked at me and she said, what were the challenges you were faced with today and yesterday that were most pressing for you and most frustrating? And in every floor we went to, she got a response, and she was able to quickly address most of them. Others required a little more time. And so it was a great learning experience and a positive reinforcer that those right questions get answers, and they're real answers. And sometimes the situation is so simple. It's not that anything is really complex, but it's just asking those right questions so they can be addressed and solutions can be collaboratively found.
Exactly. It's just, I see this as, for me, I see this as a learning experience. Ultimately, I'm going to look back in a couple of years and grow and grow from this. I'm going to be a different person.
You're going to be different and color the next situation that comes up and look at that differently, both in your interaction with the care providers in hospitals as well as with your spouse.
Exactly. And I would like this to be, I've already decided that in health terms, my wife will survive because I know she's in one of the best hospitals in the United States getting care. But I've decided that I'll be a better person from this.
Well, that's beautiful, Geoff. And I think that that's so important because when you look at this bad situation that you're going through from that positive lens of how am I going to learn and grow from this so that tomorrow is even better than today, it's inspiring and motivating both to yourself and to others and helps you to get through the day so that you can see your situation as more positive rather than more negative. And that is much more fulfilling and improves your well-being as well. So it's a very great attitude to behold. I think that with this, we should maybe kind of wind down and maybe you can let the listeners know how to reach you and then I'll do the same.
Okay, I can be reached through my website, geoffgrantconsulting.com, GeoffGrant consulting.com. They can read my bio, they can learn a little bit about me, and they can contact me through the website. And I would love to have a conversation around self-care, caring for your loved one, and I look forward to engaging with our viewers.
Okay. And likewise, I can be reached at drkaren.org. And you can read more about me and understand how I have been very involved both as a care provider and a caregiver. I've had my son who has grown up with severely chronic challenges since birth. I've had to care for my parents. I've had to care for a sibling with mental health. So I've been through all the channels that can arise, plus family members with lesser issues, but still important issues that have to be addressed. And it's really important both from any of those hats. And I would welcome any discussion to be able to hear what other people have to say. So again, contact me at drkaren.org and you can learn more about my consulting and or just have another conversation. Thank you
very much, Karen.
It's been great chatting with you.
Talk to you soon.
Bye.